Okay. All right.
Okay, go.
Hello, my name is Fernando Zuniga, and this is the second episode of our podcast, and we are going to continue the topic of health. And I am joined by,
Hey, Lonnie Watts. Hi.
I'm also joined by,
Han Hong.
uh, with,
Samara Cherokee.
also with,
Christian.
Um, and
finally.
James. And James.
So, Leilani and Ton, what exactly are your goals when it comes to, this whole COVID situation when it comes to health?
Well, regarding the pandemic, our current goals are to cut childhood deaths, treat and prevent more illnesses, and improve mental and physical health.
We also hope to promote more healthy lifestyles, prevent measures, and modern, as well as efficient healthcare for everyone. And our target audience is mainly America right now, like all the Americans, because
Yeah, of
we all
course.
live in America and it mainly affects us. It directly affects us because we're one of the highest countries in the top cases and top deaths and like
Yeah,
where most people are sick, right? And it's just real important to focus on that first, and after that, like we can definitely focus on more worldwide measures. And so, Fernando, what further goals outside of the pandemic do you think we should take into consideration?
well, with our further goals, we would like to, reduce maternal mortality. Sure, we've had, far less cases of that, but still sadly exists, and we want to, have less and less of that. Have those children, still have their mothers be intact. Also to, have those children, still be alive, of course. To not have those horrible, horrible deaths that could easily be prevented, and of course, not have a situation like COVID-19 again with um, fighting these communicable diseases, pretty much.
Thank
So
you,
yeah,
Fernando.
I have to say.
And moving on to Samara, do you have anything else to add on to the things that we can see as goals for worldwide situations?
Yeah, so with how things are going right now, our main target is to prevent and treat substance abuse and to reduce road injuries and deaths. We also plan to have universal access to, sexual and reproductive care, family planning, and education. And we hope to achieve universal health coverage.
Thank you, Samara. And moving on to Christian, do you have anything to add on to our universal, like worldwide goals that we plan to focus on?
Yeah, some more goals is we're trying to reduce illnesses and deaths from hazardous chemicals and like pollution. We're trying to implement more framework convention on like tobacco control and all that, like smoking basically, and research and support more the development and universal access to like vaccines and medicines. Like make it more affordable for people to access that and actually get the treatment. So yeah.
Thank you, Christian. And last but not least, James, what do you have to say about worldwide goals that we can focus on in our situation for health and well-being?
Some goals we can focus on is increasing some health, financing, and support health workers in developing countries. We can also improve early warning systems for global healthcare risks. We can reduce mortality from non communicable diseases and promote mental health.
Thank you, James. And I want to thank each and one of you for joining us here today in our podcast. And goodbye.
All right. Goodbye.
Bye.
Bye there.
I just wanna add one more thing real quick before we go. Like all these goals are basically like not just focus on like COVID, but like global health problems that we need to like fix on right now. Even though COVID is like our main problem, we still have a lot of problems that all of us are trying to accomplish and like try to put more awareness out there for people.
That
And
is true.
yeah,
Um, yeah, we decided to include not only worldwide problems that we can look at for healthcare and well-being, we also decided to include the COVID situation because it's a really big deal in our history, and it's just really nice to be able to focus on that and just see what we could do to help others. Mainly our own country focused at first because it directly affects us. We could get sick. We could possibly even pass away, which is a really sad thought to think about. But focusing on that, just be able to bring the bigger picture towards everyone in mind, and outside of that, we can definitely focus on other people worldwide because the problems don't just exist in our country, but there are many problems that exist in other countries as well. And it's just a good thing to be able to focus on everyone, just not ourselves.
Yeah. Other than that, like that's basically it. We're good now.
All right.
So
Yeah.
that's our podcast on our SDG, good health and well-being, and what our goals in action is, and who our targets are. So thank you for joining us today.
Yep.